Cool. All right. We're live. We're recording. Let's have some fun.
All the
So
buttons are pressed.
all the buttons are pressed. All right. We can hang at this. We're pros now. All right.
Yeah.
Dr. Renaud, welcome to the Med Matrix Method podcast. So excited to have you.
Thank you.
Yeah.
Yeah. Thanks, Cole. How are you?
I'm doing awesome. I'm really
Good.
excited about today's topic, which is sleep, which, as everyone knows, is really important. But we're about to
Yeah.
find out actually how important sleep is. So quick little housekeeping before we get going here. My name is Cole C. from one of the co-founders of Med Matrix. And everything, we're talking about today, this is not medical advice. This is really for educational purposes. If you want medical advice, you're welcome to become a patient with Med Matrix, and we'll help you out. But other than that, this is for educational purposes. I'm sure we'll go through some at home things you can do as far as like sleep hacking and sleep
Yeah.
hygiene. So there's definitely gonna be some value. Actually, there's gonna be lots of value today. I'm really excited. So let's set a good foundation here. With an intro from you, Doctor. Why don't you explain kind of your background with functional medicine and really like
Sure.
the difference in how you approach sleep than a conventional doctor might?
Sure. I'm Dr. Colin Renaud. For people that don't know me, I'm one of the full-time providers at Med Matrix. My background is pretty diverse. I have a background in alternative medicine and conventional medicine. I'm fellowship trained in functional medicine. I have a master's degree in nutrition. So I've been practicing functional medicine for about 10 years now. And sleep is always one of the things that we talk about really with every patient. I do anyway, and I'll speak for my colleagues. I know they do. Sleep is a really difficult thing for patients, especially in the conventional medical space, because the issue with sleep is it's very multifactorial in its etiology and sort of what drives poor sleep or sleep issues. And again, from the conventional Western, whatever you want to call it, medical approach, sleep is just another thing that we have found medication for. So when people have trouble sleeping, it's just another thing that you can go on medication for, sleep aids. So it really just becomes another prescription that people add to their roster, right? I can't sleep. All right, well, here's a sleep medication. Good luck. So sleep is just such a complex tool that is so important for our longevity and our physiology and really our ability to thrive and be healthy. If we don't sleep, it's, when patients tell me they don't sleep and they don't feel well, it's like, all right, we got to stop there, right? If you can't sleep, it's almost like it's very hard to optimize health. So it's really important.
Sure. Okay.
And so many people
So
don't. So many people don't.
yeah, I guess when you say sleep
Yeah.
well, like it's kind of
Yeah.
is that a subjective thing, or like what would you consider good
Yes.
sleep?
So we hear a lot about getting, a certain amount of sleep, right? 6, 7, 8 hours. But we have to talk about the different types of sleep. So really what sleep is actually doing physiologically and like deep sleep. So there's slow wave sleep, for hormone production, immune system repair. So deep sleep, or really what we call slow wave or stage 3 REM sleep, is the most physiologically restorative form of sleep. When a person gets about 8 hours of sleep a night, it allows for about 40 to 100 minutes total of substantial deep sleep, the way the sleep rhythm goes. So if you're sleeping about 8 to 10 or 7, 8 hours, you're getting about an hour of really deep sleep. That's how the sleep cycle goes. So during this time, the body really undergoes really critical repair processes. It can help with tissue repair, immune system strengthening, relaxes the cardiovascular system, helps with the brain, waste removal. It's really the reset. So if you're one of these people that has interrupted sleep, you go to bed at 10, you're up at 12, you fall back asleep again 2 hours later, you're up at 3, you're not getting that deep sleep, which is the restorative kind. So you might be sleeping, say, a total of 4 to 5 hours, but if you're not sleeping long enough, then you're not getting in this deep sleep. And that's really where you need the restorative benefit.
Okay, and then just
And people
for
don't quite understand that part. So that's the important part.
yeah. So why, like, I guess again for context here, like, why is sleep so important?
Yeah.
Like, what is sleep? I mean, we get it. Like, we wake up, we feel, energized again, or some of us don't, but
Yeah.
that's the hope, right? Like,
Yeah.
why, like, what is sleep actually doing on a scientific level that's so important?
Sleep is repairing, like physiologically, layman's terms, 7 to 8 hours of sleep with adequate deep sleep as part of that is your nightly like repair shop, quote unquote. So it performs physiological repair and restoration on the body. And it's also maintaining brain function. It's also maintaining good metabolic health. That's another really big part of this too, is the metabolic piece. So really, sleep is your reparative time. And if you're not getting the repair, what happens is there's a cumulative over time of poor sleep. So people think, oh, I'm not sleeping well tonight, so I'll just sleep more tomorrow. It doesn't really work that way. The body needs this repair every single day to really get to a physiological norm. So people that have altered schedules or shift work, a lot of my colleagues in healthcare that work overnights or they work really odd schedules and they don't sleep well because of work. They work long days, it really can affect how they function. And it can be very hard to function optimally without good sleep.
Okay. Well, that's a shocker. I'm sure a lot of people they've had a bad night of sleep and then they catch up. I mean, to some extent, right? I mean, you can catch up on sleep, but I guess you dive deeper into what you meant by that. Like you need that every single night. Like what happens when you get one bad night of sleep?
Yeah, you need it for every night because what's happening from a repair perspective, and I'll give you some examples. So there's tissue and muscle repair that happens when you sleep. So deep sleep induces maximum secretion of growth hormone, which helps rebuild the body. It helps repair. It helps regenerate and rejuvenate muscles, tissues, tendons, bones. Also, it strengthens your immune system. So one poor night of sleep can really affect your immune system's ability to repair itself and be optimal. Another thing is you have to sleep to rest your cardiovascular system. So your blood pressure needs to drop. You need to allow that dip in blood pressure to really give your system a break. And then one of the most important things from a sleep perspective and longevity is brain health. So deep sleep acts as it's like a deep clean on the brain, if you will, where the fluid in your brain, it's called cerebrospinal fluid, sort of washes out the toxins in the body and in the brain. So we see this, one of these toxins is something that's linked to Alzheimer's disease. So if we think about risk factors of long-term issues, right, poor sleep could be linked to neurodegenerative decline, because if you're not washing out your brain every night, like you go to bed and you wash your face and you take a shower or whatever, your internal body needs washing at night. That's why you're sleeping. So your brain gets washed overnight, and that's how it gets rid of metabolic waste. So a lot of these things are really important to do every single day as a cumulative, right? We don't brush our teeth, say, a couple times. Well, maybe some people do, but you do it every day, right? You eat certain things every day. You take care of yourself a certain way every day. So if a couple times a week or 50% of your week is poor sleep, it's really hard to catch up, as they say, on some of these things with sleep being lacking.
Yeah. And what do you see happening when you have consistent bad sleep over a prolonged period of time? Like what does that cause?
People most of my patients that have chronically bad sleep, they are just, for lack of a better term, they're zombies, or they are what we call wired but tired people, where they are stressed, their body is overloaded, they're not feeling well, they're trying to sleep, but they can't. So when they get to bed, they're not sleeping well, they're up most of the night, or their sleep is broken up. And then what's happening is they have to get up in the morning and they have to go about their day. They have to go to work. They have kids, they have spouses. So their body is in this constant state of overdrive where the nervous system is just on all the time. They can't relax. Their body's in a fight or flight all the time. And it just snowballs into blood sugar instability, hormonal dysregulation. And then it just keeps going from there.
Okay.
Yeah.
How does that cause hormone instability? How does it cause insulin issues?
So adequate sleep regulates your cortisol, which is your main stress hormone. So when you regulate your cortisol, it can reduce stress, it can reduce anxiety, and promote emotional stability. But also from like a tissue and muscle repair, right? There's the hormone of growth hormone, which helps with tissue and muscle, and then the hormone insulin, which controls your blood sugar. So deep sleep helps stabilize your blood sugar, which improves insulin sensitivity. So there's a lot of hormones involved with sleep and sleep regulation.
Okay, gotcha.
Yeah.
When a
Yeah.
patient comes in, it's kind of like I'm imagining it's this catch-22. So you have a patient who's not sleeping well, but
Yep.
they're also not healthy. They have hormonal issues,
Right.
they're fatigued, they're gaining weight, all hypertension, all these different things. Is there like, do you like approach the sleep first? Do you approach the health first, or do you have to do those at the same time? Like, how are you starting to look at a patient who's having issues with sleep?
That's a really, really good question. And you have to kind of do as much together as you can, because if patients aren't sleeping well, it's going to be this goes back to some of the things I've talked about on the podcast all the time. If people have poor nutrition, they're not eating right, if they're not sleeping, those are such foundational things to being essentially healthy and feeling good, that if it's not there, it's really hard to get people to feel better. So what we have to try to do is set goals and say, okay, listen, we have long-term goals that we need to work on, whether it's weight loss or hormone function or gut health, but we need to also find solutions to you sleeping better right now, right? You're probably not sleeping good right now because of some of these bigger issues. But if I want a chance at getting you better, I need you to start sleeping better in the short term. So we often talk about, chronic nervous system hyperarousal, or this fight or flight state that people are in. We often talk about circadian disruption. So things like blue light, people are on their phones, for hours until they go to bed. They watch TV for hours before they go to bed, and all this light that's on your eyes and on your body, it mimics the sun. So people's circadian rhythms become very off. There's a lot of things we can discuss in terms of actual physical changes to sleep. If they have obstruction in their airway, or they're a mouth breather, or their nose is chronically clogged. So there's a lot of stuff that we can do from a sleep hygiene perspective to get people to feel better, and also certain supplements, certain herbs we use to help promote sleep. But ultimately, it's a restorative process with long-term care. But like I said, it's really hard to get people to feel better if they're not sleeping. So we have to try to find ways to do that initially. It's really important.
Okay. Well, let's park the conversation here and talk a little bit about sleep hygiene more, and kind of like some myths and like what's good, what's not. First thing that you said that I think a lot of people are going to kind of be curious about, want to know about, is like, how is your nutrition connected to sleep?
So from a blood sugar perspective, if you're having blood sugar spikes where your blood sugar goes up and down, sort of inappropriately based on what you're eating, it definitely can affect your ability to have your circadian rhythm in proper alignment, which is what controls your sleep cycle. So if you're not eating the right foods during the day, if you're not eating the right foods before you go to bed to promote decent sleep, then it's going to be hard for you to sleep. One of the biggest things I educate my patients on all the time is you really should be eating about 90 to 120 minutes, so an hour to 2 hours before you go to bed. You should be stopping eating at that time. You really need to be eating protein, a healthy fat, avoiding like high glycemic carbs, so carbs and sugars that spike your insulin, because then you're going to have blood sugar instability and it's going to be hard for you to fall asleep. So those are usually issues that people have a lot. They're night eaters, they're snackers, they've been at work all day and they're emotionally eating or whatever, and they're sitting all night eating, and then they're snacking, and then they're trying to go to bed, and they're on their phone, and they're stressed. And so there's all these different things that are going to contribute to poor sleep hygiene from a diet perspective, for sure.
Okay.
And the other
Um,
thing that's important too to note for that is when you stabilize your blood sugar overnight, if you're not eating and spiking your blood sugar before you go to bed, it affects how you wake up.
mhm.
So if you're eating poorly, spiking your blood sugar before you go to sleep, you're going to have a poor night's sleep, and then you're going to have a really hard time getting up. You're going to be one of these people that needs like 5 cups of coffee to get out of bed.
Yeah.
So what you do before you go to bed affects your ability to have the sleep and the adequate blood sugar and the adequate sleep cycle, and then it will reflect how you wake up the next morning. So
Okay.
this is what I'm saying. It's an everyday thing. It's really hard to say, oh, well, I had a couple bad nights. I'll just make up for it this weekend. It's cumulative over time. It's really not that easy to do when you've
Yeah.
had bad nights consistently. So
Okay. So let's play a game here.
okay.
If I wanted to ruin my sleep solely through nutrition, walk me through what I would eat to just ruin my sleep and how I would eat it.
Well, you would eat a late dinner.
Okay.
So you would eat right before you go to bed. And you'd eat something that was really, really simple carbs, like a big bowl of pasta. No protein, and you'd probably have like some ice cream after.
Okay.
And then you'd try to go to bed. And while you're doing all this, you'd be looking at your phone, right? Checking your Instagram, checking TikTok, cat videos, or whatever you like. And then you're like, oh gosh, it's 11 o'clock. I got to go to bed because I have to wake up at 5 to go back to work. And then I'm laying in bed, staring at the ceiling. Oh my God, it's 2 a.m. Then you have sleep anxiety because you're anxious because you're not sleeping. And then you maybe finally fall asleep at 2:30 and your alarm goes off at 5:30 and you're like a zombie.
Yeah. And then you drink a shit ton of coffee.
And then you're drinking a crap ton of coffee because you got to go back to work and work a 12-hour day or something. And then you're doing it again the next day. So yeah, that's how you really screw up your sleep. For sure.
Which is like not that hard. Like a lot of people,
No.
like a lot of people do eat a whole box of pasta and then they eat ice cream and then So I mean that's a good example.
And the other thing that's really the other thing I was going to say that can ruin your sleep overall is you really, and this happens a lot with people in different phases of life, especially younger people, you really should be going to bed and waking up at the same time every single day. You know, weekdays for people that are shift workers, like 9-to-5ers, they're on a schedule right through the week. They wake up, they go to bed at say 10:30, 11 o'clock because they have to wake up at 6, 7 to get to work. Okay. But then it's Friday night, Saturday night. Oh, party. I got a birthday to go to. I got a thing. I got a whatever. I'm going to go to the club. I'm going to go do this, whatever. You're up until 3 a.m. And then you're sleeping until 11 o'clock the next day. You're totally off now. And then you're trying to get back on a rhythm to go back to work. So then like Monday, Tuesday, Wednesday, I'm like dragging because I stayed up too late. And then it comes the weekend again and you do it again. So ideally, people should be going to bed and waking up at the exact same time every single day, no matter what day it is.
Okay.
That's the best way to regulate your sleep cycle.
Okay. What happens when life isn't perfect and you
exactly.
you have a friend's birthday party or you're at an event and it goes late, a wedding, like how long does it take you to recover from, one night out? Like,
well, it depends. Yeah, it depends on how bad your baseline is, right? Do you have a poor sleep schedule, poor sleep hygiene the rest of the week, and you have one, I don't want to say bad night, but you have a night that goes against your normal cycle? Yeah, I mean, everybody does it. I've done it. I don't like to do it though, because it makes me feel bad. Like it's almost like you pay for it the next day, but it's like, oh, it's 10:30. I got to leave so I can go home and go to bed. I'm not going to be one of those people. But sometimes you have to be. It depends on your lifestyle. So it's an ideal to go to sleep and wake up at the same time every day, but it certainly is not perfect. But I try really hard on the weekends. If I'm going to bed a little bit later than I normally do, I'm not one of these people to lay in bed a lot longer. I'll still wake up fairly early to be consistent with my schedule, and it makes me feel better.
Yeah.
I'm not sleeping till 10, 11 o'clock on the weekend just because I can. If people like that, they like the feeling of it and it feels restorative, but it's actually counterproductive to do that.
Interesting.
Yeah.
Can you explain that? Like,
Yeah.
why is sleeping in on the weekends not productive? Like, actually goes against your health?
Because well, I don't want to necessarily say it goes against your health, but it's starting to screw up your sleep cycle, and it starts to disrupt your sleep rhythm. So this rhythm that we're in is something that should be consistently every day. That's why I call it a rhythm. So if you have blips in it, then you're disrupting the rhythm. And when you lay in bed till 11, 12 o'clock on a weekend, because it's like, oh, it's Sunday, I'm just going to have a lazy Sunday and lay in bed till 11 o'clock. It just creates a change in your rhythmic physiology of sleep and your feeding schedule and your blood sugar. Your body is designed to be on a schedule. So when you don't adhere to that, it starts to throw it off very easily.
Okay. Gotcha.
Yeah.
All right. We're still on sleep hygiene. My last question on a follow-up, my weird last question on a follow-up question, which was, now if you wanted to have the best absolute sleep using nutrition as your main, tool, what would you do specifically to get the best sleep through nutrition?
To have the best sleep in terms of nutrition is, again, no eating past like 90 minutes, 2 hours before you go to sleep. You want to have something that's protein focused and a fat at your dinner. You want to be avoiding simple carbs that will spike your blood sugar. And if you're having a carbohydrate, it needs to be in proportion with the protein and the fat. So something smaller. You're not eating junk. You're not eating sweets. You're not snacking. And that is really you're turning all that off, like I said, about 90 minutes to 2 hours before you sleep from a nutrition perspective. Yeah.
Okay. What do you think the most overlooked sleep hack is? Because everyone knows they shouldn't be on their phone in bed, but like, what's the most underrated sleep hack?
One of the most underrated sleep hack is sleeping in a cold room. So you can regulate your physiology and your circadian rhythm by temperature hacking yourself a little bit. So if you take a warm shower or like a bath before you go to bed, what happens is it induces what we call rebound cooling. So what happens is when you take a warm shower, the body will rebound into a cold state to kind of balance out the warmth that you were in for the shower, and cold helps you fall asleep better. So the studies show that you should be sleeping in a cold room, like 68 degrees, 70 degrees, no more than that, to help induce deep sleep. And there's actually studies that show sleeping in a cold room helps you lose weight. So, plus there.
Let's dive into that. Why do you know much about this? Like, why does sleeping in a cold room
it has to do with the synthesis of fat, certain types of fats, brown fat versus yellow fat. Cold temperatures at night, as you're balancing your blood sugar and as your body is restoring itself, it helps burn the bad fat. So when your physical body is in a cold room going through this cleaning process and this restorative process, if you're in a cold environment, your body can do it much more efficiently than if you're in a hot environment. Heat is not as restorative overnight as cold is. So if you think about your body as as a organic thing, right? We are a living, breathing thing, like almost like a plant or an animal. If you put us in cold as we sleep, we do better for restoration. That's just a physiological thing that the body does better in overnight. So
do you remember what the optimal room temperature is for losing weight when you sleep?
It's the studies show, I think it's between 66 and 68 degrees. I think that's...
so it's not like anything crazy. It's not like...
No. It's not like, you're not like putting yourself in the refrigerator to go to bed. Nice. But most of the studies say like 68 degrees, I think, is the optimal temperature for adequate sleep and weight loss promotion that crosses over. There's like some overlap there. So sleep in a cool room. That's my biggest sleep hack.
Nice. Love it. Yeah. All right.
Yeah.
Phones and sleep. How much does being on your phone close to bedtime disrupt your sleep? And when should you stop being on your phone if you want to get really good sleep?
So the research shows that phones should be discontinued about 90 minutes before bed. No screens.
Wow, 90 minutes.
Yeah.
I don't
Yeah.
even do that. That's
I
wild.
know. I don't either. I'll admit it. I don't either. I don't, luckily, knock on wood, have issues with my sleep. But yeah, 90 minutes is really what the physiology of the body shows and what some of the studies show. So your phone has certain colors in it, specifically blue light. So your phone mimics the same rays and energy as the sun. So if you're sitting like, right against your face for hours before you try to go to bed with your phone, you have it really close to you. What your body thinks is happening is it feels like there's sunlight on you for all this time. So it's getting confused about what time of day it is. So you're laying in bed, you've got your phone, right? We've all done it, and we've all seen the memes, right? Of people like in a
Yeah.
dark room with their phone, like 2 inches from their face at 2 a.m., watching like a cat video or something, going down some rabbit hole. And then it's like, oh crap, I got to get up for work in 6 hours. I got to, put your phone down and like, okay, I got to get to sleep. So if you've been on your phone for hours, your body thinks it's been exposed to sunlight all that time because of the way the phone mimics the sun, the same rays of light. So
Yeah.
your body is confused about what time of day it is, and it can and it can alter your brain chemistry too, because what happens is you have increased dopamine, which is the feel good chemical, and it can also inhibit your melatonin, which is the sleep inducing chemical. When you have phones constantly on, TV, same thing. So you're pretty much altering your natural brain chemistry that you need to fall asleep. So phones are tough. It's really, really tough. And it's something that we have done to ourselves over all these years because, right, phones didn't exist not that long ago. So we didn't have, but we were watching TV maybe or something similar. But now we have TV and phone. We've got two things,
Right.
So
Okay. Do red
yeah,
light glasses work as far as like, or those blue light blocking glasses?
yeah.
Do
The
those work?
they do block out the light, but again, if you were to wear the glasses and still have your phone on you, the light is still hitting your body. It's still hitting your skin. Your body still knows it's there. So it might be blocking the light, but you're still emitting the phone is still emitting the light in the different frequencies.
That's crazy. All right.
Yeah.
Before we move on from sleep hygiene, I have another little game for us to play. I'm gonna have you
Okay.
rank. I'm gonna have you rank
Oh, nice.
sleep gadgets 1 through 10.
Okay.
A little explanation. All right.
10 being the best.
10 being the best. 1 being
Okay.
never do that.
Okay.
Okay. All right. Blue light glasses.
I'd say like a 5.
A 5. Okay.
Yeah.
Give a little explanation of like why you said it.
I'd say they're okay, but it's not you don't wear the glasses so you can be on your phone, right? It's like if I'm going to wear the glasses so I can be on my phone, that defeats the purpose.
Okay.
So if there's no screen, you don't need the glasses, is my point.
Okay. What about an eye mask, like sleep mask?
Sleep masks are great, actually. And it's not really tech, but sleep masks are really good, especially the weighted ones. Some of them have weight to them, so they can help like with puffiness in your eyes or whatever. You can put them in the cold. You can put them in the freezer so they're cold. Sleep masks are really good. Blocks out light. Yeah.
Okay. Nose strips, or sorry, mouth strips.
Mouth tape.
Mouth tape. Yeah.
I'm a mouth taper. I am a mouth taper. I will admit.
Okay.
So mouth tape is really, really good because if you are a mouth breather, you are not properly oxygenating. So when you breathe through your nose, the air is humidified better, and it's better for the air quality is better humidified through the lungs. So you're oxygenating your system better. If you're a mouth breather, you're not getting that oxygen exchange as well. And also mouth breathers are more prone to snoring, which also is disruptive. So,
okay.
Yeah.
Gotcha.
Yeah, it's a great idea.
So what was the number again? Sorry.
The number? Oh, sorry. 10. I didn't give a number. I'm
10.
sorry.
All
I would
right,
say
nice.
a 10, like a 9 or 10. Yeah, I'm a big mouth tape person. I think they're underutilized for sure, and the studies are really supporting their use.
Cool. All right. What about a cooling mattress?
Yeah, definitely. The one,
Number.
uh, that's hard. I would say a 7. And the
Okay.
reason for that is because a lot of mattresses and cooling mattresses, they're highly toxic.
Mhm.
So from like a toxic perspective, I think we're gonna have a whole podcast on this, like how to detoxify your house. Mattresses are highly toxic things, but if you can maintain a cool environment in your room, that's the plus.
Okay.
So maybe, yeah, maybe even like a 6 or something. So
6. Okay.
yeah, yeah.
6. All right. So just on the edge of like helpful.
Just on the edge,
Yeah.
right?
Like,
It's like, yeah, some of those types of mattresses are highly toxic because of what they put in them to have that effect. So it's
mhm.
like, is that a great idea for your health overall? Probably not really.
What about
Is it
the
much?
what about the ones like I saw the only one I know of is called 8 Sleep, like they have the cold water that goes through that. Have you seen those before or no?
Yes, I have. I have seen those.
Okay. Are those still toxic?
So I don't think as bad. I'd have to look. I don't know exactly what they're made of, but they have a lot of organic mattresses now on the market. Unfortunately, they're much more expensive than a traditional mattress that you would buy or a
Sure.
discounted mattress. But organic mattresses that are low toxin or toxin free are much better for you. Put your mattress, open the window, have a fan, something to cool your room down. I know it's tough when it's the middle of winter and it's 2 degrees outside. You can't have your window open. I mean, probably some people do, but
Practical.
yeah, cooling your room and sleeping on a good quality mattress would probably be my preference.
Okay. Heard.
Yeah,
How about white noise?
white noise is good. I would say probably like a 7, 8. But it depends on the person because white noise can be stimulating for people. It's not supposed to be, but if people are really chronically in this sympathetic fight or flight, the white noise might be disruptive. So there's also like the thought of people that sleep with the TV. Is that good? Is it bad? If I need a TV to go to sleep, is that a bad thing? Is it disrupting me? The jury's out. It's probably not the best thing. You need quiet to calm your mind down.
Gotcha.
Yeah.
I've been listening to white noise every night for probably 6 years, and it's great. I just
Okay.
turn it on, and it's like this, like
Yeah.
habit. It's like a signal for my brain, but that's a long-term play.
Yeah, yeah.
Um,
The signals of white noise can be really, really beneficial. It's like 528 hertz, I think is white. No, I might be, you'd have to look it up. I don't know. I don't know what the signal of the frequency of white noise is, but it's supposed to interact really well with your brain chemistry.
yeah.
But I have had people have trouble with those types of things because I think their nervous system is too hyper aroused that they need complete quiet to turn their mind off.
Okay. Gotcha.
Yeah.
What about earplugs?
Earplugs are good. I mean, not really like a sleep tech thing, but especially if you have a partner that's disruptive or snores or something, earplugs are good. I'd say like a 9 for
Okay.
sure. Yeah.
Let's see. All right. Am I missing any sleep devices? Did I get them all?
I mean, that's a lot of them. There's not really a ton of sleep
Sleep hacks.
devices, sleep hacks. Yeah. I mean, one thing is some of the supplements and things we use prior to bed and certain things that are really good, like magnesium is a really good sleep,
Yeah.
melatonins, some of the herbs can be really, really helpful. But yeah, that's a lot of good sleep tech, sleep hacks for sure.
Okay. Cool.
Yeah.
Yeah, we're gonna get into sleep supplements, sleep apnea, functional medicine,
Yeah.
root causes, sleep issues.
Yeah.
I think that about wraps that up. So let's talk about melatonin actually for a second because
Okay.
like melatonin is sometimes abused, right? Like it's not used. Like walk me through how you should properly use melatonin.
So yeah, melatonin is it's a natural hormone that's produced in the brain that regulates the sleep wake cycle. So what it does is it signals darkness, and so your melatonin increases at night. So it basically is the physiological way of telling your body it's time for bed, like it's dark outside.
Mhm.
So it increases in the evening to produce this sort of situation of like winding down. right? Or what we would call quiet wakefulness. So, it's late at night, it's dark outside, the sun has gone down. Your body is starting to signal to itself, okay, you're supposed to be starting to calm down, right? So then if you're like on your phone for hours, you're totally messing that up, right? You're giving yourself all this artificial light, watching TV for hours and hours, which everybody does. I'm guilty of that. So the melatonin is a natural way to induce the quieting of the body and the mind. So when you have exposure to light at night, especially blue light, like we talked about, it blocks the production of melatonin.
Okay.
So if you're taking melatonin, you're ODing on melatonin, and you're on your phone all night, you're completely wasting your time.
Yeah.
Does that make sense?
Totally. Yeah.
Yeah.
I could totally see someone like taking melatonin. Oh, I can't sleep.
Yeah. I can't sleep. And they're like, just
Yeah.
downing melatonin, and then they're on their phone for hours and hours. Like, oh my God, this melatonin's not working, blah, blah, blah. It doesn't work. Yes, it does. You're just not doing the right sleep hygiene to help you get to bed.
Sure.
And it's not that simple, right? A lot of people are doing all the right things. They're still struggling with sleep. So that's a bigger, deeper issue. But there are a lot of really simple things that people just don't know are affecting their sleep.
Yeah, that's perfect, because that was actually my next question, is what happens when you're doing all the right things? Like everything we just talked about, you have proper sleep hygiene, but you still can't sleep. Like what's going through your mind now?
So this is where sort of the functional medicine approach and sort of getting into some of the more specific clinical things, we can talk from our perspective at MedMatrix, what we do, and just from like a functional medicine perspective is what is causing sleep disruption. Is it chronic nervous system hyperarousal? Is it blood sugar instability? Is it circadian rhythm disruption? Is it sleep disordered breathing, like we were talking about sleep apnea or mouth breathing? Is it hormone imbalance? Is it a gut problem? Is it technology overload? And in a lot of people, it's a lot of these things. They've got their melatonin and they've got their magnesium and their herbs and whatever, but like the example we used earlier, they've got their pasta dinner, and I've got to have a little bit of ice cream, and then I've got to have a little bit of wine, and I've got to watch my Love is Blind, or like I got to watch my reality show until 11 p.m. It's like oh my God, I'll just watch one more episode. It's like addicting. I have to watch this episode. And then it's, you're getting your body all worked up, and, oh, I'm going to have another, couple chips or something, 'cause I'm still hungry, or, and then I got to check my phone before I go to bed. Got to check my email real quick, my Instagram. Oh, somebody commented on my post today, whatever. And then, oh my God, I got to go to sleep. It's 12 a.m. Oh gosh, I got to be up. I got to go. I got to make sure I'm at the work tomorrow. I got to get a good night's sleep. I have a meeting in the morning. This is our life, right? This is what we do. This is how we live. And I'm not saying I don't do some of these things. I'm not guilty of this, but this is life in the 21st century. We are doing all of these things, and then we sit and we wonder why we don't sleep well. And then we wonder why we don't feel well. So it really comes back to so many of these habitual things we do every day that are causing hormonal imbalance, that are causing gut problems, that are causing blood sugar instability, hormonal imbalance from like cortisol and melatonin and things. So it's a snowball cascade. And that's really where the beauty of like a functional medicine approach comes in, because we can take a patient and say, okay, these are the list of things we need to start looking for. How many of these apply to you? And from a lot of people, it's probably a lot of them. So that's really where you have to start from a long-term perspective of getting people better.
Okay. Gotcha.
Yeah.
So, okay, going through the sleep hygiene things, but
yeah,
what happens when you still do all those things and still not sleeping good?
Well, like I said, you have to look at people's hormones. You have to look at their blood sugar. You have to, check to understand if there's a gut problem. Serotonin synthesis and melatonin production is disrupted when you have gut health issues.
Okay.
So about 80% of someone's serotonin is made in the gut. It's not made in the brain. So if you have a gut problem, then your serotonin, that feel-good hormone, is going to be really disrupted. And then also melatonin is produced in the brain by the pineal gland, but you can have disruptions of melatonin in relation to serotonin if there's like IBS issues, chronic gut issues. So you got to start looking. You have to start looking around at places. People, women that are perimenopausal, that have low progesterone, progesterone declines in perimenopause and menopause, low testosterone in men. You'll have reduced deep sleep. You'll have reduced REM sleep in these people. So they're not restoring. They're not having that repair shop that I talked about and that cleaning out of the body overnight. So you have to start digging around in some of these normal physiological things that are supposed to be working well that aren't.
Okay. All right.
Yeah.
Before we get into like kind of how we understand gut issues or hormone issues and like some of the things you do every day to solve that, let's talk about sleep apnea for a little bit. What is sleep apnea? What is the root cause of sleep apnea, if that's the right way to put it?
Sleep apnea, it has many causes. So sleep apnea really can be like an anatomical problem. So a common disorder, sleep apnea is a common disorder of sleep. And what can happen is when you're laying down, right, on your back, for some people, the way their jaw and their mouth is like built, your jaw can fall back. So like if you're laying flat and your jaw falls backwards, because of whatever, the way you're shaped, your anatomy of your jaw, it blocks the airway a little bit. So you're not getting enough oxygenation into the lungs, and we need the oxygenation to repair everything. So some of the most common causes of sleep apnea is being overweight, because obesity, and you have more fat around the neck, it can cause a smaller airway. So when we worry about obesity, that's a really big common thing, but it's certainly not, it's not everybody that's obese doesn't have sleep apnea. There's also something called central sleep apnea, which is more of like a neurological thing where the brain does not send proper signals to the muscle that manage breathing. So your breathing muscles aren't working well. And a lot of people snore, they will gasp or choke. So they're like trying to, like they stop breathing for a second, and then they like wake up temporarily and they like gasp for air, and then they fall back to sleep. So a lot of people will get excessive daytime sleepiness. They have a headache in the morning. Their mouth's really dry because their mouth's been open all night. They've got a sore throat. They're irritable, trouble concentrating. That's a really like a bit of a rundown on sleep apnea. But the weight piece is a big part of it. Being male is another thing. Most sleep apnea people are, not that it can't affect women, but most of the time it's men. And like I said, if there's an anatomical thing about the way your jaw is shaped or the way your tonsils are shaped, sometimes it can not be something you're doing, but it might be something anatomical.
Okay.
Yeah.
When someone comes in with sleep apnea, if it's not an anatomical issue, how are you, besides losing weight, is there really much else they can do?
So weight loss is the big thing, especially if it's obstructive sleep apnea, where it's a physical obstruction of the airway versus central. Avoiding alcohol before bed is really helpful. Sleeping on your side can be really helpful. And obviously when you're asleep, you can't really control where you're going. But if you sleep on your side, then your jaw doesn't fall backwards, so you're not obstructing your airway. Some people have special we call them oral appliances, that are made by specialty dentists and oral practitioners to help keep your mouth open, to help keep your jaw positioned in the right way for you to sleep. CPAP machines, which is a machine that uses air pressure to keep the airway open, is one of the most common things that we use to treat sleep apnea. And if there's anatomical obstructions, like a large tonsil or something, sometimes you have to have surgery for that.
Okay. All right.
Yeah.
And then, well, you mentioned weight being the biggest kind of needle mover on sleep apnea, but when you don't sleep well, it's hard to lose weight, right?
Yeah, it just becomes a vicious cycle. So, losing weight, it's an easy thing for for someone who has sleep apnea that's overweight to go to their say conventional doctor, primary care, and the doctor says, well, you need to lose weight. Oh, okay, sure. Well, what does that mean? It can be a very, very empty statement to a patient to say, oh, you have obstructive sleep apnea, you're obese. That's probably one of the leading reasons why you have this issue. What you need to do is you need to lose weight. Okay, have a nice day. I'll see you in 6 months. And what is the patient supposed to do with that information? Right? It becomes a very it becomes almost like a pointless statement. It means something. It's important, but what does it mean to the patient? Well, how do I do that? Where do I even start? So that's where, from our perspective in the functional medicine world, we can understand weight loss. We can understand all the other things that are going on. And it's not just this blanket statement of lose weight, which a lot of people just don't know what to do with. So it's hard. It's really hard. And that was sort of my comment earlier when we started the podcast, is to say, well, weight loss doesn't happen overnight. So we need to find ways to help people sleep right now. We talk about sleep hygiene. We can talk about other things with the patient, but the long-term goal is ultimately the weight.
Yeah. Yeah, and if you're listening right now and you're one of those people and your doctor said, hey, just lose some weight. And we just did a podcast on GLP-1s. We've done several on weight loss. So just go check those out on our YouTube channel or on any major podcast platform. So, okay, now let's kind of get into the meat of this, like functional medicine and sleep issues. Let's start with how conventional medicine looks at sleep. Like, you go in your doctor, you're not sleeping well. What's happening as far as like in the system of conventional medicine, and their limitations? If you can just explain the full kind of functional approach to sleep issues, a conventional approach to sleep issues, that would be helpful.
So most of the time it's going to be a sleep aid. A sleep aid means some sort of medication. It could be melatonin, which is typically over the counter. Certain antihistamines like Benadryl can help with sleep. They can cause drowsiness, so we use them to sleep. Okay. There are prescription medications that are often prescribed to help you sleep. So prescription drugs, there's different what we call benzodiazepines, which is a type of drug that you become more addicted. There's more dependency with that. Yeah. There are non-dependency, what we call hypnotics. So there are drugs that are supposed to induce sleep, make you tired. Sometimes there's antidepressants that are recommended. There's also herbs that are used more in like the natural medicine world. So from a conventional medicine perspective, like I said at the beginning of the podcast, sleep is just another symptom that in the medical world is just, oh, here's another pill for you to take, on top of the 10 you already are on. I don't feel well. I'm on 10 pills and I'm not sleeping. Oh, okay. Well, try this low dose benzodiazepine and see if it helps. It just becomes another pill for the pill box. It's not really a solution. So,
okay. Yeah. When is something like, because prescriptions do have a time and a place. So when is something like when are you thinking like, okay, I should prescribe something like
I'll be honest, Cole, I don't think I've ever prescribed a sleep aid in my career. It's just not my thing. I don't usually use prescription sleep aids because most of them there's some level of dependency. And do I want to introduce a medication that the patient is going to become dependent on for sleep? Not really. And some of these drugs are controlled substances. So they have very high dependency risk. So I don't really prescribe them. I honestly, to think about it, I don't think I ever have. And I probably never would. Because it's really, it's not my philosophy to do that from a healthcare perspective.
Okay.
Yeah.
Let's talk about your philosophy. Like, so patient comes in with sleep issues.
Yeah.
I know you want to figure it out. Like, what are the first things you're starting to look at?
The first things we're starting to look at are a lot of what we talked about already. Sleep hygiene. I will use certain herbs that are very effective. I will use certain supplements that can be very effective for sleep. That's a place to start, right? It's not an answer, but if it helps, great. So if we pair some of, dietary change, lifestyle change, sleep hygiene with some natural stuff, or even some over-the-counter medications that don't have dependency risk, that's a really great place to start. That's how I start with most people. Yeah.
Gotcha. What about sex hormones? How do sex hormones play a role in sleep?
So sex hormones are really important because there's an induction of the deep sleep. So when you are, say, perimenopausal as a female or have low testosterone as a male, it's gonna be really hard to attain that deep sleep. For example, progesterone is the rest and digest hormone in women. So during menopause, perimenopause, when progesterone starts to decline, sleep often becomes one of the most common issues for women. So when we evaluate hormone levels in women, progesterone is one of the first things that we do. So if you have progesterone decline, you can have reduced deep sleep, which is the restorative. Same thing for men. Reduced and low testosterone reduces REM sleep and deep sleep. So the sex hormones are really important for sleep.
Okay.
Yeah.
Gotcha.
Yeah. One of the most common symptoms, like I said, in menopausal women is I don't sleep. We call it, and I think, my colleague at MedMatrix, Dr. Rose, and her and I have talked a lot about hormones on this podcast, and her and I talk about the witching hour. It's this time between 2 and 4 a.m. that most women in menopause are waking up. Almost every menopausal, perimenopausal woman will say, yeah, I wake up every night at like 2:30. Yep, of course you do, because your hormones are starting to decline, or they've become very deficient. Extremely common. Extremely common.
Wow.
Is the sleep issue for women. Yeah.
Okay. What are other, levels that decline with age that play an important role in sleep?
In terms of like hormones or things?
Hormones, thyroid, nutrients, anything.
I mean, thyroid can change. Melatonin production can change. The synthesis of melatonin, the synthesis of serotonin can change as we age. So a lot of the hormone changes can really come together in full circle as we age. Not as much of a problem specifically than the sex hormones. The sex hormones are one of the most important things that are naturally declining, that are directly affecting your sleep.
Okay. Let's talk more about gut health. You mentioned how serotonin's produced in the gut. When you have suspicion that a patient's sleep issues is linked to their gut, what are you doing? What tests are you running? What solutions are you looking at, et cetera?
Yeah. So a lot of times we can do, and we do this a lot at MedMatrix, is we'll do some advanced stool testing to really understand the health of the gut, to look at, the bacteria in there, to look for what we call dysbiosis or imbalance of the gut. So there's a lot of gut issues in people that are not well understood by their doctors. They kind of are labeled as IBS, which is kind of just like a catch-all phrase for I don't know what's wrong with you. So if sleep becomes an issue, it can be linked in there too. But sleep is not, in my experience, sleep is not necessarily just a gut problem. It's really a multifactorial problem in that person. And the gut's probably playing a significant role, but it might not be the only role. It's not, I wouldn't necessarily just look at the gut. There's a lot of other things I would be looking at. But the gut is a really important part of it for sure. Because like I said, the serotonin piece, the melatonin piece, really, really important, because of the gut-brain axis disruption. Because what happens ultimately is if your gut is not doing well, there's something called the gut-brain axis. It's a part of your nervous system where the two organs talk to each other. So your gut talks to your brain talks to your gut. If your gut's not performing well, something's wrong, there's imbalance, there's a parasite, there's whatever, it's going to talk to your brain and put your brain out of whack. So that's going to put your melatonin out of whack, and then you're not going to sleep well. And it can be a back and forth kind of thing.
Okay.
Yeah.
Understand.
Yeah.
All right. So guys, if you are joining us live right now, we'll do a little bit of Q&A. If you have some comments here, just drop them in the comments and we'll get to them. And while we're waiting for people to do that, let's do a case study. So Dr. Renaud, can you explain a patient case that came in with sleep issues and kind of the whole patient journey from what they were struggling with, what they were told in conventional medicine, and kind of what the resolution was?
Not necessarily a specific case, but I will say that I don't know how many, and this goes back to what I was just talking about. So many of my men and women that have low sex hormones, estrogen, progesterone, testosterone, almost every single one of them comes in complaining of poor sleep. So when we start regulating the hormones, sleep is one of the things that is most dramatically improved. So as of lately, I've had a lot of females that are perimenopausal or menopausal. And one of the first things that they say when I start my visit is, my sleep is just so bad. And I'm waking up every night at 2:30, 3 o'clock, and I can't fall back to sleep for an hour. And when we start hormone replacement, appropriate hormone replacement, I meet with them a few weeks later, a month later, or whatever. It's like, oh my God, I'm sleeping for the first time in years. And we might not do anything else, right? But start restoring hormone function and getting them to sleep better, and they're functioning better, right? They're getting up in the morning. They're not totally wired and like totally falling asleep at the same time. They're feeling much better overall. They're not feeling as inflamed. They're not feeling as sluggish. They're not drinking 2 pots of coffee to go to work. So almost every, I would say my case study is almost every perimenopausal and menopausal woman I treat is they start to sleep better, and it really turns the corner. Same thing with men, testosterone, it's the same thing. But I think women, it happens more to women. Not that it doesn't happen to men, it does, but I certainly see it, I think, a lot more with my female patients in this age range with hormone decline. Yeah.
Do you have a case study that I know this is just thrown at you, but do you have a case study that wasn't related to sex hormones, like wasn't a perimenopausal? Or...
For sleep?
Yeah.
I've had patients with poor sleep over my career that have a lot of what we call nervous system hyperarousal, where they're in this low-grade sympathetic state. And the sympathetic nervous system is the part of your nervous system that's the fight or flight, where you're going to like go attack a bear kind of thing. So a lot of my patients over the years have struggled with this as an issue in terms of this sympathetic overdrive. So when we talked on the podcast a lot about trauma, and we've talked about chronic stress and sort of how this impacts the nervous system. So I've had a couple cases where when we can try to address some of the sympathetic overdrive that people are experiencing, it puts their body in a whole new calming state, which can promote sleeping too. So I have had some success there. That's a much more complex thing, though. It's not as simple as like getting people on hormones or, a supplement or something. But that's a really remarkable part of something that's maybe not looked at as very medical, right? It's much more like mental health or, stress and trauma and this fight or flight state that people are in. So that's another part of it that can be very successful. Yeah.
Okay, great. Cool. Well, let's do some questions here. We got Chris and Lisa. Guys, let's do some more questions. If you have questions, put them in the comments. Let's get a couple answered here. So let's just put this on stage. I'll let you read it.
Are we really supposed to sleep 8 to 10 hours a night, or is the Italian ways more ideal? I don't know. What are the Italian ways? Do you know?
Let's assume the Italian way is like 6 hours a night.
So yeah, I think the Italian way is much less. So from what we understand about the physiology of the body, not necessarily 8 to 10, the recommendations and how I always approach it is 7 to 8. So I just use the number of 8. Some resources will say 6 to 8. If your quality of sleep is really, really good for like 6 hours, then you're getting a decent amount of REM sleep, which is very good. So it's not necessarily the timing, it's also the quality. So if you're sleeping really, really well and you're getting good deep sleep and you're getting continuous, say, 6 hours of sleep, that is really good, right? If you're getting 10 hours of interrupted sleep, that's worse than the 6 hours of really good uninterrupted sleep. So you have to look at it. It's not that simple. But we are supposed to sleep like 7 to 8 hours continuously every night. Yes, we are.
Yeah. Gotcha.
Yeah.
What is your opinion on, I can't believe we didn't even say anything about this. What is your opinion on sleep trackers like Whoop, Apple Watch, Oura Rings? Like,
I know. And we were talking about this.
yeah.
They are really good. I mean, I think their efficacy and their accuracy is getting better over time. But it can really help you look at how much deep sleep you're getting. Because the trackers can monitor your physiology and your blood pressure change, and they can really understand the deep sleep. So I think they are really important. So if people are getting, say people are getting good sleep, like they're getting maybe say uninterrupted, but they still feel really tired, some of the trackers can be really helpful to understand how much deep sleep they're getting. So you might be sleeping 7 hours continuously, but you're not in REM sleep.
Yeah.
And that's where the physiologic repair comes in. Yeah. So they can be really helpful. Yeah.
Yeah. Good question,
Yeah.
Chris. All right, we got room. I've seen some questions coming here. We got room for 2 more questions. So if you want a question answered, we got 2. Oh, we got room for 1 more question. Last question. So get it on the comments if you want a question answered. Next one.
What is Benadryl? What about Benadryl causing dementia? So there have been some studies done that basically links chronic use of Benadryl and neurodegenerative declines such as dementia. So this is really seen in very long-term high dose use of Benadryl, and Benadryl is an antihistamine. I commented on that earlier. Antihistamines are often used as a sleep aid because they make you tired. Some of the studies that have been done that link Benadryl and dementia are not the best in terms of their quality. So I don't know that this is a definitive, at least for me. But really, some of the evidence does potentially show much, much higher doses than regularly prescribed, and long-term use may be associated. But the studies that have linked this are not the strongest. So it's a bit of a weak understanding. I think we're not very clear about that quite yet.
Okay.
But would I, even irregardless of dementia, would I recommend a patient pop a Benadryl every night to go to bed? No. Does it help sometimes? Sure. If we're using it temporarily, sure. But that's not the answer. So, yeah.
Okay. Good one.
Yeah.
This one's more of a statement, but I'll let you. I'm sure you'll add to this.
Yeah, let's see. 14 days after getting hormone pellets, I was sleeping through the night without Ambien. Ambien is a sleep aid, for those who don't know. I will never forgive the Women's Health Initiative for keeping HRT from me for 20 years. So I'm assuming this person is saying that when they got on, their hormones, they just changed their entire sleep cycle and their sleep habits, which is great. I see it all the time. So hormone pellets are an option. There's different ways of administering bioidentical hormone replacement. So yeah, it's a really, really powerful thing to change a woman's hormones.
All right, next one.
Yeah. Are you able to assist with hypersomnia and sleep apnea? Yes. I think we sort of proved that point throughout the podcast. Hypersomnia is a excessive daytime sleepiness disorder. So usually caused, but it can cause brain fog. It can cause a lot of daily fatigue, cognitive dysfunction. So it's trying to understand that better. Like, where's that coming from? And same thing with sleep apnea. Where is it coming from? Is it an obesity thing? Is it a structural thing? Yeah, there's lots of ways we can intervene on this for sure.
Can you go a little deeper on how like the initial intake
sure,
and how that kind of relates to helping someone get answers around that?
Yeah, so with initial laboratory intake for patients at MedMatrix, we're looking at multiple parameters of their overall health, including cardiovascular markers, thyroid markers, nutrition markers, as well as hormones. And we're trying to get a good baseline of what they're dealing with. So during an initial visit, we talk a lot about sleep hygiene, and talk about their medical history. So it might not be something, especially with like a sleep apnea, right? If it's related to obesity or some sort of structural anatomical problem, that's a long-term goal, right? That we have to address. But like I said earlier in the podcast, there are certainly things that we could do right away to understand sleep hygiene and what could be affecting sleep from a more conservative, and I don't want to say easy, but things we could do that are much more manageable up front. There's a lot of things to be done. Yeah.
Yeah, totally.
Yeah. Next question, is MedMatrix offering all delivery methods of BHRT, creams, pellets, and injections? So BHRT is bioidentical hormone replacement. So we offer all delivery methods of HRT except pellets. We don't do pellet insertion. It's not that it's bad. It's not something we're using readily. We feel that patients get good outcomes from creams, injections. We don't have a lot of patients looking for pellets. I think pellets are a very specific treatment for patients after they've been on hormone replacement for a long time. Hormone pellets can be a little bit hard to control in terms of dosing because it's a physical implant in the body. So we have not started doing pellets. I don't know if we would, but we get best results with the other things we're doing in terms of HRT.
Yeah, I think there's plans to start doing it in like a year from now. From what I've heard from the other medical team is like, it's just, you put in a pellet, and if like, 'cause everyone's so different, right? And like, if your body doesn't agree with those hormone levels, and like makes your health worse, we can't just stop it like you could a cream. Right. It's like, it's just, you're kind of stuck with
pellets. Are tough. I have done hormone pellets for a long time. I am certified to implant hormone pellets. I do know how to do it. I've done it for many years. And I find, and I'll have colleagues that might disagree with me, I find that hormone pellets work really well for men, because when you implant testosterone and you know the dose for a man, it's really, really simple. It's kind of like a set it and forget it. If you're doing pellets for women, women's hormone replacement is much more delicate in terms of balance. So if you're implanting a hormone pellet, it's probably for a woman who's been on hormone replacement for a long time, and you know the exact dose you're giving. There's not a lot of guesswork. Would I ever recommend hormone pellets for a woman who's never done hormone replacement before? Never, 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 because you cannot titrate. You can't take it away. Once the pellet is implanted under the skin, it's there for like 3 to 4 months. So if the dose is too high, you have to live with it for months until it wears off. So usually pellets are reserved for long-term hormone replacement, especially for women if they've been on hormone replacement a long time already. Yeah, it's kind of fallen out of favor a little bit for women. Like I said, men is more common. So I think that's why we haven't jumped on the bandwagon at MedMatrix with it.
All right, last one.
Yeah, this is a comment from Instagram. Panic attacks and insomnia corrected, ? Hormones, ? I struggle with sleep, but the panic, I'm not afraid of anything. So this kind of goes back to the comment I was talking about earlier with sleep anxiety, and where sort of, some sort of hyperarousal of the nervous system marked with cortisol dysfunction, stress hormone dysfunction. So definitely if there's some sort of nervous system dysregulation, which could be inducing panic attacks, could that be affecting insomnia? Absolutely. So if sleep is an issue, we have to go back to some of the sex hormones, some of the cortisol, the stress hormones, and really understand the nature of this more from a physiological perspective with insomnia. It might, because if this person is saying I'm not afraid of anything, it's not necessarily that. It's probably a physiological problem.
Okay.
Great questions.
Yeah. Great questions, guys. So last thing here, what walk us through the optimal sleep routine, all the gadgets you're using for sleep hygiene.
Oh, me?
Walk us through your sleep routine.
I'm fortunate that I sleep really well. I do have a fairly unquiet mind, though. My mind does race. I'm one of those people that does have trouble sometimes turning off my mind. So I, I can do better about the screens. Lately, I've been trying to be better about not doing as much screens before I go to bed. But I think the one thing that helps me is I have a very specific routine, like almost every night before I go to bed, in terms of how I do like my physical hygiene, shower, face stuff, moisturizing, all that stuff is very specific. I'm eating at the same times every day, every night, so that helps with my rhythm. I do use mouth strips. I am a big mouth strip person. It helps a lot with my breathing. And actually, since I started using mouth strips maybe 6 months ago or a year ago, they definitely change how you feel the next day. They definitely make you less groggy. You wake up easier because the oxygenation is much better when you breathe through your nose. I sleep in a pretty cold room, like 68 degrees, and no noise, pretty dark. So that's kind of what I'm doing.
Nice.
I used to have, similar to what you're doing, Cole. I used to have an app that played rain.
Mm-hmm.
I'd fall asleep to like the sound of rain because it was very calming, but I kind of got away from it. I don't know. I lost interest.
Okay.
But I think my sleep is really good because I have a really good routine.
Yeah. And you're doing a lot of the other things, right?
Yeah, it's very routine every night, and I'm doing some good things, so it helps keep things regulated.
Yeah,
for sure. Yeah.
I've really started paying attention to my sleep ever since kind of getting into functional medicine, and it's game changing. I like to say I'm a pro sleeper. I'm like, it's awesome.
I don't think it's something that you can really appreciate until you stop having it. If people,
totally.
If people have poor sleep, they really can misunderstand how much it's affecting them, and you kind of forget. Right? If you're a chronic bad sleeper and you're just not feeling well for years and years and years, you kind of forget what it's like to sleep well, which is not great. So it's a really important thing that everybody needs help on, usually.
Yeah. All right.
Yeah.
Well, I got a little surprise for everyone who joined us live, who made it all the way to the end. We really appreciate when patients take the time to educate themselves. Patients who are more educated are more successful in their health. So if you join the webinar and not a patient, there's a link that was just posted in the comments. And you can actually get $200 off as a new patient. We never discount that much, but for people who join the webinar live, you can, if you book a new patient consult, free assessment before 7 p.m. tonight using that link, you can get $200 off as a patient. So this goes away at 7 p.m. You have to do it now. If you're interested, just copy and paste it, put in your browser. We'll stand here for another couple, 30 seconds here to give you time to do that if that's what you want to do. Definitely don't miss out on this kind of little discount we're doing here for new patients. And with that said, thank you, Will. We appreciate you. Anything else you want to add to bring us home here?
No, I mean, I think we've talked a lot, about some of the really important things that are people struggle with, and sleep hacks I think are really, really helpful. So try to adjust your environment, try to adjust the temperature of your room, try to adjust your sleep, your nutrition schedule. Put down your phone. There's a lot of things that could be really, really beneficial for people that are really easy. So, yeah.
Perfect. Yeah. Chris, what if you're already a patient? Email me. I put my email in the comments there. I'm gonna have to delete that later, but email me and I will. If you already got a discount, I'll give you whatever the difference is to 200, and you can use as a patient. We appreciate you joining. And then share this with friends. We'll take care of you.
Yeah. Must be in Maine or New Hampshire, though. That's a disclaimer to be a patient.
You have to be Maine or New Hampshire. All right, guys. That's it. That was awesome. I learned a lot. Hope you did too. And we'll see you in the next one. Bye, guys.
Thanks, guys. Bye.